what benefits do you see in using laser therapy?
What I see with it is that it promotes healing, exactly what I learned 30 some years ago. It heals from the inside out and above down. And it's very non-invasive. You're not going to do any harm with it. Pat is a lady that I treat. She's in her 50s. She's had sinusitis for as long as she can remember. And we are on about 8 or 9 treatments on her sinus, and she says she can't believe the difference. I had a 91-year-old woman come in that had lateral epicondylitis, her tennis elbow so bad she couldn't flex her arm, she couldn't enjoy her coffee, and 4 treatments with that. And her daughter came in and said, "I cannot believe what I've seen here."
Do you feel that laser therapy has made it possible for you to treat conditions that in a better way than before?
Without a doubt. For example, with the woman's older ladies' tendonitis, I mean, we can adjust the elbow if it's subluxated or misaligned, and we can do ultrasound, and we can do icing and things like that. But I've been doing this an awful long time. I have almost 10,000 patient files. I've seen a lot of people, and to see the resolve in 4 sessions is pretty miraculous. So, right.
So what are some of the advantages you see to the power lasers?
Well, first of all, it is very easy to handle. And it's very easy to set. It is hermetically sealed, so if you are treating, let's say, somebody for a foot condition or whatever, that you can take a alcohol swab and sterilize it before you go on to the next patient. The settings are very easy, and like I said, the vibration is something that's important to the patient, because laser therapy is basically uninterpretable to the patient. They don't know what's happening. So when they get that vibration sensation, then they interpret that something's happening. So, and it's, I guess the ease of use is really the main thing.
If you were to say that I had a tennis elbow, would you mind demonstrating how you would treat that with the power laser?
Not in the least. It's very user-friendly. There's a manual that comes with it. What I would do is I would look up epicondylitis, which is tennis elbow, and in your case we'll say it's lateral. And so it is real simple. I would get the PL Pro 500. I would turn it on, just that simple. The settings are right here. Then we go to P1, treatment 2, and it's 1 beep per, in this case we're going to use tender points. So we will come up to, we'll pretend like it's your right elbow here. And what's nice about it is that there is a vibration that maybe you can pick up or maybe you can't. 2 things: it lets me know that it's working, and probably more importantly, it lets the patient know that something's happened. So if this is a real tender spot, then we would treat it, and it tells me there that we do a beep per point. So there's the beep. So then we would switch to another tender point, and we just simply go through and we would treat all the tender points. Typically on tennis elbow like this, right here again, and it tends to hold true in my practice, 10 to 12 treatments and 3 to 4 treatments per week, and it's just really kind of that simple.
What would you say to a practitioner who's thinking about adding laser therapy as a service to their practice?
My advice to another chiropractor would simply be, we are here to help as many people as we can. And I think the very vast majority of us chiropractors want to help people get better naturally. And so what better way can you think of than light therapy to help somebody heal from above down, inside out? And so it's a tool like anything, and it's a very handy tool for many things that I've seen in my office. So it's just, you're expanding your ability to help people get better. So it's a tool that I would highly recommend for any chiropractor.